So how does what's the mechanism of reducing those blood sugar spikes and like the A1C? How does it help the diabetics? Because I was diagnosed as pre-diabetic, and that's why I'm really curious about metabolic health and blood sugar regulation. Can you explain to us the mechanism on how the product actually lowers the blood sugar spikes and helps reduce the A1C levels?
Yeah, absolutely. So basically, this product stimulates GLP-1. So your microbiome stimulates GLP-1 hormone. And the way that this works in your body is that when you eat food, and that food makes its way to your gut microbiome, you have these specific strains, which are the ones that are in Pendulum Glucose Control and Pendulum Metabolic Daily. These specific strains metabolize that food, and they stimulate GLP-1. And GLP-1 is a hormone that metabolizes sugars in your bloodstream, and so it stimulates that whole response. And then it also tells your brain that you're full. And so it's I was thinking of GLP-1 as sort of like, when you go fill your car with gas, and then it kind of has that click, and that's when the thing knows, like, okay, stop adding gas because the fuel is full. Yeah, GLP-1 is your body's click. And so when GLP-1 gets made, your brain's like, oh, I'm full. I don't have to eat any more food. And so the microbiome is responsible for generating that click for you. And so for a lot of people, if you don't have these strains, you don't get that click. You never really feel full, or you get weird food cravings, and certainly your body isn't metabolizing properly the sugars that you just ate. And so what these strains do is they stimulate GLP-1. They provide that click. And so that's really how they work.
It's all through the GLP-1. It seems like butyrate is what we need. The GLP-1 is what we want to stimulate.
Yep.
And is there a way in these pills, does that help secrete more GLP-1? Does that give us more GLP-1? Does it create more cells that create the GLP-1?
It directly stimulates the release of GLP-1. And there are only 2 strains that have ever been published to date that can do that directly. And one of them is Akkermansia muciniphila, and the other is Clostridium butyricum. So, at the end of this, if you remember nothing, it's just that those 2 strains, Akkermansia and Clostridium butyricum, are really important for your metabolism and your gut health. And we are literally, losing them through all these different things that we're doing, but also things that are happening to us. And so it might just be that you have all these metabolic issues and digestive issues because you're just missing these key strains. And that's really what we're delivering back.
That's amazing work. And the fact that you guys are the only ones that can do that, if that was sequenced by that Cornell prof, it's cool to see that there's a company like yours that's doing work that's clinically proven. You've had the results, you have the receipts to show that your work is real and legit. And I definitely want to start the product. I want to try. I just had my blood tested a couple weeks ago. I want to try, go on it for, as you mentioned, 90 days. Do my high fiber diet as well, and then test again and see what happens afterwards. Because I think the proof's in the pudding. If you can replicate the results, I think that's what it's all about, right?
Absolutely, and it's perfect. And we have so many customers who share back even more benefits that they're getting. And again, I would say it's really important to think about the microbiome and nutrition as very much paired. So, it's like if you have like an amazing car, you want to have, in order to have that amazing car, you have to have a top-notch engine and give it top-notch fuel. And so your body's the same way. To have a high-performing body, you have to have a top-notch engine, which is your microbiome, and give it great fuel, which is all this high-fiber, high-polyphenol foods. And when you have those 2 together, now you're really going to be humming. And so that's really the goal, try to mix those together.
Okay, so if the 2 strains that can create the butyrate, the Akkermansia and the Clostridium butyricum. Okay, if those are the 2 strains, are there preferred fibers that these 2 strains like?
Yeah, the main fiber that there have been the most studies around is inulin. Inulin. And so you can get inulin in like Jerusalem artichokes. Those are also called sunchokes. Asparagus. It's in a wide variety of different foods. And it's also in a lot of the supplements that you can buy. So, the scoops and things that you can put into shakes and morning drinks. A lot of those also have inulin in it. And so you can get it from either supplementation or foods. You can't really get it in the dose you need in a pill. So it's usually going to come in one of those scoops or in actually these foods.
Does your product have inulin?
Yeah. And so in the Pendulum glucose control pill is inulin, and that is what's feeding those strains. So it kind of gives it a jump start. And the reason we put the inulin in with them is because, after you kind of the pill bases well at a distal colon, we want the food to be with the probiotic strain. So, it's like if I was dropping you off on a deserted island, would you rather I drop you off by yourself or with a cooler full of sandwiches and beers?
Yeah.
So the inulin is the sandwiches and beers, and so it gets delivered in there. But still, eating foods that are high in inulin will additionally help.
Because it makes sense. If you don't have the snacks, you don't have the food to kickstart it, it could just die potentially and not colonize. And
Yeah.
at that point, it's useless.
Yeah, exactly. And part of it is because when we did our clinical trials, we wanted to know exactly and specifically what the microbiome intervention was doing on its own. So we literally told people, don't change your diet, don't actually try to introduce higher fiber, higher polyphenol foods, just take the pills and keep doing what you're doing. And so the efficacy that's been published is really without any dietary change. So if you also do this dietary change, it's going to be like really quicker and more potent.
And so can you just walk us through what your results were and what the experiment was and what the results were?
Yeah, the publication that I was referring to is in a British Medical Journal, and it was a placebo-controlled, double-blinded, randomized clinical trial. And in this trial, there were people who just got placebo. I should say, all the people in the trial had type 2 diabetes, and almost all of them were on metformin and or sulfonylureas. And so there was a placebo group who only got the placebo pill. Then there were people who got the pill with the full formulation. And then we actually had a third arm, which was people who got the pill without Akkermansia and one other strain in it. Because remember I said Akkermansia is really a pain in the ass to grow? So when we did this trial, we were like, what if Akkermansia isn't that important? Now let's see if we really have to figure out how to grow this thing. So there's a third arm that didn't have the Akkermansia strain in it. And what we found is that after 12 weeks of being on the product, the people who were on the full formulation compared to placebo had a lowering of A1C by 0.6 and a lowering of their blood glucose spikes by 33%. And so if you're familiar with pharmaceuticals out there, you'll know that's on par with that kind of efficacy, but it's a natural product and it's giving back these natural strains that you've lost over time.